Hello everyone, I'm Dr. Amrita from the Integrated Health and Wellbeing Council, and I'm truly honored to welcome you all to this session on breast cancer awareness in collaboration with Roche. This discussion is close to our heart, and our goal today is to raise awareness, break the stigma around breast cancer, and promote early detection and timely treatment. Because early action can save lives. It gives me a great pleasure to introduce our esteemed guest, Dr. Shrikant Tiwari. He is a senior consultant and head of the Department of Medical Oncology at Sagar Multi Specialty Hospital, Bhopal. Dr. Tiwari brings with him over 15 years of rich experience in treating cancers with a wide range of therapies, including chemotherapies for both hematological and non hematological cancers, immunotherapies, targeted therapies, hormonal therapies, and bone marrow transplants. In addition to hold an MBBS and MD, he also has a DNB in medical oncology and he and is deeply committed to making quality cancer accessibility and effective. Today we are fortunate to hear from his directly as he shared his experience and expertise on this important issue. As a woman and public health advocate, I personally feel a deep responsibility to engage in this conversation, and I'm looking forward to learning more because knowledge truly is power when it comes to fighting breast cancer. Before we begin the conversation, let me briefly set the context. Breast cancer has become the most commonly diagnosed cancer among women in India. Thousands of women are diagnosed each year, and the burden continues to grow. However, we know the early detection and prompt treatment can drastically improve survival rates. Despite this awareness and around self examination, regular screening, and access to regular diagnosis remains limited, especially in the rural and the unserved areas. Thank you so much, Dr. Shrikant, for joining us today and taking the time to share your valuable insights. Doctor, it would be great if you could guide our audience through the essential aspect of the breast cancer, especially regarding its early detection, effective treatment option, and strategies for prevention. So please let us know about the advancement that have been made in screening technologies for breast cancer and how they can help detect the disease earlier and more accurately.
In cancer treatment, especially in when we are dealing with the breast cancers, the early detection is the crucial point where if we can diagnose patients in earliest stage, we can treat and we can cure the patients. So for early detections, there are certain tools which are going on since long time. There are certain new advancement is also there. So the most important things that should be a start from the safe breast examination to clinical breast examination, and after the certain age, like in a normal female, after the age of 40 years, the patient should go for yearly mammogram test. If the patient is having high risk or any genetic disease there, then we can start screening early. In certain cases where mammogram is not enough, there is dedicated MRI scan is also there, which can the resolution of which is so high that it can detect even up to zero point 0.5 millimeter of the zero point 0.5 centimeter of the tumor also, if it is present inside the breast, because in younger age the breast is little fatty and bulky. So sometimes mammogram or the conventional techniques missed that diagnosis. So the dedicated MRI, that is the breast for the on breast protocol, that can detect even smallest tumor if it is there.
Thank you, Doctor, for these insightful thoughts. This is truly valuable information for our audience. So, despite advancement in screening, many women, especially in the rural and unserved communities, still do not get regular checkup. So, what are the key barriers and how can we overcome them?
I think there are many barriers. I can explain some, certain things. The most important barrier is the lack of self-awareness. the lack of self-awareness, not in the individual, but in the lack of awareness in the society. The people think that if I am fine, I am not having any problem, why I should go for any medical test. So and especially, if normal people come to know that they are going for the screening of the cancer, they become scared. Why I'm going to screen for the cancer, although I am normal? The first important barrier is the lack of awareness, and second important barrier is especially in the rural area is the lack of the availability of the facilities. This is a very important step. In many area, if you see normal in the primary health center or even in the community health center, the many facilities are not available. If the facilities are available, the experts who can diagnose it and report it, they are not available. So these are certain barriers which are actually important hurdle for the early diagnosis and early treatment of the breast cancer.
Thank you for shedding light on this. This is true that awareness and accessibility play a crucial role in improving the outcomes. So, Dr. Tiwari, please explain how can we better educate women about the importance of self-examination and regular mammograms. Second, what are the roles of healthcare providers and media campaign can play in this?
Look, as I say that in when we are dealing with any cancer, and especially breast cancer, because the incidence of breast cancer is increasing day by day, and now it is the one of the most common cancer in India. So initially, the cervical cancer and other cancer were more common, but now due to the acceptance of this westernized culture, the incidence of breast cancer is increasing day by day. So, because it is one of the cancer for which very robust screening techniques is available, so that we should make awareness among the general society that if we can diagnose patient early, we can cure the disease very easily like any other disease. So, to campaigning is very important in this regard, that everyone should go for screening. The screening is very simple. It's neither very costly nor very cumbersome process. Neither it has any painful process and nor invasive process. So very simple techniques is available. For younger age group, we should especially in the school going kids and as well as the college, we should always motivate and as well as the educate the young girls that how they should participate in self breast examination, how they should learn how to do self breast examination as well as the clinical breast examination. By doing all these things, by increasing the awareness about the self breast examinations, clinical breast examination, as well as the participation in this screening techniques, we can diagnose cancer as early and we can cure the cancers. If you see the data of the cancer in if you compare with the western data, in western world, still the incidence of breast cancer is very high, but the cure rate is also very high. The reason behind is that because there is mass screening program is there, so the cancers are detected early and the cure rate are very high. Whereas in India, the things are opposite. The incidence of cancer is low, but the detection rate is also very low. So most of the patients diagnosed in advanced stage, and we cannot cure that type of cancer.
That is very important point you shared, that education, campaigning, and outreach play a major role in the early detection and diagnosis. So as we all know that AI is gaining a lot of attention in every field these days. So how AI is transforming breast cancer diagnosis, particularly in terms of reducing false positives and enhancing early detection?
Yes, because with the conventional techniques, sometimes the chances of having false positive results are there, and because of these false positive results, sometimes the undue apprehensions happen in the family and in the society. So due to the AI techniques, now we are more precise. The techniques are more enhanced. So by non these invasive techniques, now the radiological diagnosis are so advanced that by non-invasive techniques we can precisely diagnose whether that lump present in the breast are cancerous or not. So definitely AI is helping in making more precision in diagnosis of the breast cancer.
Fascinating insight, Dr. Shrikant. AI truly seems to be a game changer in improving diagnostic accuracy. Doctor, with the shift towards precision medicine, how are targeted therapies improving survival rate and minimizing side effects compared to the traditional treatment?
Yes, that is very important. There is many new advancement are happening in the breast cancer treatment apart from the conventional chemotherapy and hormone therapy. Now we are using targeted therapy as well as the immunotherapy. The targeted therapy are of the multiple variety. It can be a oral form of targeted therapy or injectable form of targeted therapy. Most of this targeted therapy, initially we used to go on the stage 4 cancer, that is the last stage cancer, but nowadays we are also using in early stage breast cancer. When we treat the breast cancer, especially in the earliest breast cancer, our main concern or the patient's main concern is that whether this disease will come back or not. So to minimize the risk of recurrence, these targeted therapy and immunotherapy play a very crucial role. Now if you compare the previous data from the current data, now, with the same stage, the risk of recurrence with the help of this targeted and immunotherapy has been drastically reduced. So definitely this targeted therapy, immunotherapy, and all other newer techniques, they have enhanced the rate of curability and reduces the rate of reoccurrence.
Thank you, doctor. It is great to learn how personalized treatment are making a real life differences. So, doctor, in addition to it, what new advancement in surgery and breast reconstruction offer patient for better outcomes and the quality of life after the treatment and the post treatment?
Now there is advancement is not happen only in the area of the chemotherapy targeted therapy. There is advancement happening in the area of the surgery, which is an important part of the treatment, as well as the radiotherapy. The surgery now initially in most of the patients we have to remove the whole breast. Now the breast conservation surgery is there. So the most important aspect of this breast conservation surgery is that the post treatment, the patients, if patients look at herself in the mirror, there is no difference before the treatment and after the treatments. That is very important. So the patient's confidence level became high even after the treatment. The second the part of this surgical advancement is that even if in those patients, especially in young females, because the cancer of incidence are increasing in younger females, even if the whole breast has to be removed, but now the reconstruction surgery has been so much advanced, that is the and the type of prosthesis, the breast prosthesis has been advanced, so but the patients does not feel after the treatment that they have undergone any major surgical process, and in any defect in their body is happening when see look at her mirror.
That's very encouraging, doctor. And I think that these advancements are bringing hope to many patients. So, doctor, please let us know about what role do clinical trials play in developing cutting-edge treatment and how we can increase more diverse participation in it.
Clinical trial is very important. If you see all these newer developments, whether it's the targeted therapy or immunotherapy, apart from the conventional therapy, all this therapy has been developed when the patients voluntarily participated in the clinical trials. So clinical trial is very important. New drugs are coming. So we should always encourage the patient to participate in clinical trials. Sometimes the patients become worried about the clinical trials. They feel that they become an object for the testing. But this is not the right way to explain the clinical trials. Actually, we should counsel the patients regarding the clinical trials, that very effective medicine are used in clinical trials, and in many patients, when the options of treatment become limited in that variety of patients, the clinical trials are really very important, and every patient should participate in clinical trials, because without clinical trials we cannot expect that the newer treatment will come out.
Clinical trials are essential for progress, and I think diversity in research is key to meaningful outcomes. So, Dr. Srikant, as we know that the outcomes of the breast cancer can vary drastically across the social economic lines. So, what are some successful strategies to close these gaps in access to healthcare?
In breast cancer, as I said before, that the newer advancement is there in the form of targeted therapy or immunotherapy, apart from the conventional chemotherapy, targeted chemotherapy and radiotherapy. But the accessibility is an important issue, because still the cost of many of these drugs are very high. So the affluent classes of people can afford this, but most of the populations, it's very difficult for them to afford. So definitely the government should take care of such type of things, and government should make a policy. The government is doing a great job by putting the Ayushman for the benefit of the patients. Now we are seeing many patients who cannot afford even a simple treatment. They can take treatment in under Ayushman Bharat Yojana. So, but the government should also take care of such type of medicines which are still very costly. They should be affordable to and reachable to all the lower socioeconomic state of the patients also.
Well said. Thank you for this perspective, Doctor. And I think bridging these gaps is critical to ensure equitable healthcare. So, Dr. Srikanth, as you mentioned, according to you, what policy changes are needed to ensure that screening and treatment options are affordable and accessible to all the women, regardless their background and the culture?
You know, this is the most important aspect. I think government should make a policy changes that the facilities should be available at the primary healthcare center as well as the secondary healthcare centers like the community healthcare centers. The second important aspect is that the Anganwadi worker or ASA workers which move door to door, they should also teach how to explain and counsel the normal patients to participate in this screening program, as well as they should be motivated for this self-breast examination and all these things. So by increasing the awareness about the screening and participations, compel the patients to participate, I mean normal population to participate in screening. As much as the population will participate in screening, we can diagnose cancer as in early stage and we can cure it. So the government should make every effort to compel the society to participate in the screening program.
This is an important insight, and it's true that policy level changes can significantly impact access to healthcare. So, Dr. Srikanth, what are some of the most effective community based outreach efforts you have seen for raising awareness and increasing screening in the remote or low income areas?
In like I can say in our hospitals, like we are monthly organizing camp, especially in the rural area and in the far area from the cities. The second important things now, this is the era of the social media. So by the digital advertisement and all these things, we can reach to those people also where the normal facilities is not available. So by these techniques, by advertisement, by using the conventional media, the social media, we can raise the awareness among the general public.
Thank you for this information, Dr. Srikanth. And true community efforts truly make a difference in driving awareness, increasing the screening, and improving overall public health outcome. So, at the last, what message you want to give our audience?
So I want to share a message that those patients who are having breast cancers, especially in the curable setting, they should not worry. There is very effective treatments are available, and they can be cured with these treatments. And the second things for normal public, I would like to say that they should participate in the mass screening program for breast cancer, especially because very effective technique for breast cancer screening is available. And if they participate in breast cancer screening, it will be possible to diagnose and detect cancer at early stage, and it can be cured very easily so that the patient can have healthy life forever.
As we are moving ahead, I thank you, Dr. Srikanth, for his insightful and impactful inputs. His experience and expertise has helped us simplify a complex subject and empowered many with the knowledge to take actions. A key takeaway from today's discussion is the importance of normalizing conversation around breast cancer. Awareness, education, and early screening can truly save lives, while advancement in diagnosis and treatment are encouraging. Their impact depends on how informed and proactive we are. To our viewers, don't wait for symptoms. Talk about breast health, encourage self examination, regular screening, and open conversation, especially with the women who may not have access to this information. Together, let's break the stigma, promote early action, and support one another. Thank you for joining us today. Stay informed, take action, and let's continue making a difference. Thank you.